Do you have indigestion or GI pain after eating high-fat meals? Do high-fat meals cause right shoulder pain? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. If you said yes to either of those questions, then you may have gallbladder dysfunction or gallbladder disease. Your gallbladder produces bile, and bile is what helps you emulsify fats and absorb them. So if high-fat meals do not agree with you, then you may have gallbladder dysfunction. Gallbladder surgery or gallbladder removal is one of the most common surgeries performed in the United States today. Oftentimes, people will complain of these symptoms, and the gallbladder will be ultrasounded or investigated, and gallstones will be found, and the person will be told, well, we'll just remove your gallbladder and all symptoms will abate and you'll be good to go. Oftentimes, I've met people who said once the gallbladder was taken out, that did not change their symptoms and they wish they didn't do it. So what could be causing the gallbladder dysfunction? Well, research shows that gluten sensitivity leads to gallbladder dysfunction. So if you're having these symptoms, it could be that you're gluten sensitive and you're undiagnosed. Gluten sensitivity is even less diagnosed than celiac disease, but it's probably more common. So how does gluten sensitivity cause gallbladder dysfunction? Well, gluten damages the small intestine, and the small intestine releases cholecystokinin, or CCK, when you consume fats. So fats go down the hatch, enter the small intestine, CCK is released, and that is the signal to the gallbladder to release bile. If the gallbladder doesn't release bile, the bile fills up or builds up in the gallbladder and drives inflammation and can lead to gallbladder disease. Also, if it's not releasing the bile, you're not digesting and assimilating your fats well. So that means the fat-soluble vitamins like A, D, E, and K that you're hoping to get from your food, you're not getting. That means the essential fatty acids from your grass-fed beefs and your fish oil supplements, you're probably not getting. So if you're not getting those, you may have nutrient deficiencies that are leading to a whole other host of symptoms. So you can see that bile production, gallbladder function is key to digestion and key to health. So what do you need to do? You need to be assessed for gluten sensitivity and maybe even pay attention yourself to, hey, when I experience these symptoms, is it not only a high-fat meal, but a high-fat meal combined with wheat? If so, then it's probable that you have gluten sensitivity, and it may not be the fatty meal, but the gluten that is driving the gallbladder symptoms. So one other thing that they found is that gallbladder surgery is not benign. So yes, you can live without your gallbladder, but it is an essential organ. We don't have extra parts that are needless. So when you have your gallbladder removed, that increases stress on the liver and asks more of the liver in terms of detoxification and clearance of toxins and hormones and those sorts of things. Also, research has shown an increased risk of colon cancer when in patients that had their gallbladders removed. So there are issues with not having a gallbladder. So thank you to Rebecca for asking this question. And if you are having gallbladder symptoms, do not reflexively have your gallbladder taken out, but ask the question why and address the cause so you can reach a life at optimal.